Monkeypox, how to prevent contacting this deadly virus. Monkeypox, how to prevent contacting this deadly virus. Monkeypox is an extremely contagious disease that's rapidly spreading in several countries around the world, including the United States. Although doctors are still trying to figure out how to treat monkeypox, the best way to prevent contracting this virus if you're living in or traveling to an area with monkeypox outbreaks is to avoid any contact with monkeys or their droppings, and wash your hands frequently and thoroughly with soap and water if you must come into contact with them. For more information on how to protect yourself from monkeypox, read on. What is monkeypox? According to the World Health Organization, monkeypox is a viral infection which has symptoms of a rash and fever that can be spread through close contact with bodily fluids. The virus has reportedly been found in Africa, South America, and the Caribbean. For example, from 2008 to 2011 there were 55 recorded cases of monkeypox in the Democratic Republic of Congo, where it was first seen in 1970. What are the symptoms of monkeypox? Symptoms of monkeypox are fever, rash, muscle aches, malaise, being sick, headache, and loss of appetite. Unlike most diseases caused by viruses, these symptoms can be alleviated with over-the-counter medication. The key factor in treatment is the administration of a doctor-prescribed antiviral medication as soon as possible after exposure. Unfortunately, there is no cure for this virus, but it can be prevented from spreading by early treatment. Who is at risk for getting infected? Anyone who has never been infected with or vaccinated against monkeypox could be at risk of contracting this disease. Children under the age of 10, adults over the age of 60, and people with weakened immune systems are most at risk for contracting monkeypox. People who come in contact with the virus face a 30% chance of developing symptoms. How do you get infected? There are two ways you can get infected with monkeypox. The first is if you come into contact with someone who has it, which is why it's so important not to touch anyone who might have the virus and to cover your mouth when you cough or sneeze. The second way, although rarer, is for a person who has contracted the virus and then recovers from it, but still carries the infection, to share items that come in contact with their skin like food or water. Where did it originate? The virus which causes monkeypox has been discovered in African rodents and primates, but it is unknown where the virus came from. The severity of infection can vary greatly and often has little to no effect on many people. In more extreme cases, symptoms include high fever, joint pain, headache, and a characteristic rash that starts as small bumps before developing into large blisters filled with fluids or blood. What is being done to help control the outbreak? Authorities are currently attempting to control the monkeypox outbreak by asking people in the affected regions of Africa to put down their live animals, vaccinate and quarantine their domestic animal population, and educate people about infection. In addition, a vaccine for humans is in development and early testing for effectiveness has shown promising results. Does the vaccine work? The vaccine is not the best form of prevention for those who are immunocompromised. For those with a normal immune system, it is considered moderately effective. Which countries have been affected by the outbreak? The disease has killed and infected people in many parts of the world. More than half of those affected have died. There is no vaccine available to protect against monkeypox. Because of the virus's ability to mutate, there is no specific way of predicting where the outbreak will happen next. The World Health Organization recommends being on alert for any reports of outbreaks or suspected cases in areas where populations are dense and live close together with little access to health care. When can we expect to see an end to the outbreak? With more cases of monkeypox being reported, there is the potential for panic. Currently, health officials are tracking down the individuals who may have contracted monkeypox from infected squirrels in their backyards or some other similar location. According to Dr. Christopher Lewis with Ohio State University College of Medicine's Division of Infectious Diseases, a pandemic would likely not occur until someone has traveled internationally and contracted monkeypox and then brought it back into the United States, regardless if they're aware they have it. Thank you so much for watching. Please subscribe, like and click on the bell.